News and information from Georgia State experts about the current global health crisis. This is 88 Affairs, a program for our Georgia State University community and WRAS listeners. I'm your host, Andreas Preuss. Joining me for a conversation about public health policy during this pandemic is Rodney Lyn. He's the Interim Dean of the Georgia State School of Public Health. Lyn's research focuses on school and community health, the reduction of health disparities, and childhood obesity prevention. Dean Lyn is also a co-principal investigator for the Prevention Research Center at GSU. Dean Rodney Lyn joins me. Thanks for talking today.
Happy to be here.
Dean Lyn, tell me about the Georgia State Preparedness Task Force. You're a member of this task force. What are you and the other members doing for the student body and Georgia State community?
Well, President Becker, early on, I think it was even before this COVID-19 pandemic was called a pandemic, President Becker convened this preparedness task force to really prepare the university community for us to do the work that was necessary to ensure that the university community was ready to respond to this outbreak. And, we have the good fortune of having a president who was a dean at the University of Minnesota during the SARS outbreak. President Becker has some prior experience with infectious disease pandemics. So I was asked to be a part of the preparedness task force, and an important role for the group was really to look at the existing preparedness plan, infectious disease, and to revise it, to strengthen it. And we all had the opportunity to meet, to look at that, to provide feedback, and to strengthen that plan. So that's certainly been one of the things that we did right out the gate. After several weeks, it was clear that this was going to be and had become a major issue. The work and the plan had to be put in, operationalized, I guess is the best way to say it.
And then the School of Public Health, what is specifically going on there involving the pandemic?
So we have several faculty members that are very active in responding to the pandemic. Dr. Gerardo Chowell has been developing mathematical models to look at and forecast the incidents associated with COVID-19. He's been looking at deaths, projecting that as well. Dr. Hyman is a physician trained in public health as well. He's been really looking at issues of equity, but also looking at response of the state and federal government to the pandemic. And additionally, we have CDC-funded Centers for Disease Control and Prevention-funded Prevention Research Center in Clarkston. So our team of faculty and staff have been working closely with partners in Clarkston, the community. We have a community advisory board that's made up of members from the community and leaders of community-based organizations. And so we've been meeting with them, working with the nonprofits on the ground to ensure the community has access to the testing that they need. But there's also educational activities going on because there are language barriers. It is a community that has a high proportion of immigrants and refugees who may not be reached, we're finding have not been reached by traditional communication. So we've been reaching them via social media, translating guidance from CDC and other organizations into 15 to 20 different languages. And we continue to work to bring resources to the community and ensure that they have what they need to navigate this pandemic.
Yeah, and I spoke to Professor Ashby recently, and he said that the refugee community, this does impact them differently than other people, residents, U.S. residents, or people in the city of Atlanta. And Clarkston is, as you said, kind of an epicenter of the immigrant community in Atlanta. Your expertise is public health policy, community health, and health disparities. And you're also into food and nutrition. How are you doing research, or how are your impressions about food and nutrition during the pandemic?
Well, I would start by saying that there are a few things that are more important than being able to access and consume healthful foods on a daily basis. One of the challenges associated with this pandemic is that it has increased vulnerability of populations that were already vulnerable. So, if we really look at across the board, seniors who access federally subsidized meals in group settings like senior homes or food banks, individuals who have a low income, many of them have lost their income altogether at this point. But when you tell the public to purchase 2 weeks of groceries and shelter in place, if you can't afford 2 weeks of groceries, it means you can't shelter in place and that you have to be constantly going back out to acquire more food. Individuals in communities with limited access to healthful food. There are many people who rely on public transit to get to the grocery store. If those public transit routes are reduced as they currently are, then that is a real barrier to accessing the food that your family may need. Additionally, grocery store delivery is expensive, and you can't do curbside pickup at the grocery store if you don't have a car. So there are real challenges there. And then children, this may be one of the biggest areas. We have 34 million children combined that get free or low cost meals through schools and child care centers in this country. And if those are closed, how do those children get access to the nutrition that they need? So, we're really looking at those populations that are vulnerable and how this pandemic is impacting them.
And as the state of Georgia has started easing restrictions and people are beginning to visit businesses and even restaurants are open, not all of them, but a lot of them have decided to open, there is certainly a link between diet and immunity. And of course, the concern about a second wave of the COVID 19 hitting later this year, the winter. What about building immunity?
I would sort of make a distinction here. You're not going to get immunity from the virus through nutrition. Your immune system will be not as strong if you don't have good nutrition. So we really want to ensure people have the nutrition that they need so that their immune system is operating at an optimal level. That doesn't necessarily protect them. It doesn't protect them from the virus, but certainly if you have a weakened immune system, you may be more susceptible to severe illness as a result of the virus. So that's why we really want to ensure people have the nutrition that they need. I mean, we also need to recognize that the vast majority of seniors in this country, as an example, have chronic condition that they are managing, and so ensuring that people have access and seniors have access to good nutrition is paramount in ensuring that they can maintain their health and well-being.
I'm speaking with Rodney Lyn. He's the interim dean of the School of Public Health at Georgia State University. Dean Lyn, as you mentioned, this pandemic has brought a new set of challenges involving community response, community health, public health policy, and you kind of mentioned some of the health disparities. What about, especially in the state of Georgia, the larger percentage of African Americans and the COVID 19?
Well, yes, that's what the data that we're looking at is showing us that African Americans are overrepresented among those that have COVID 19 as well as those that die from COVID 19. That's certainly something that's difficult to see, and it's having a real impact on African American communities in the state of Georgia. Part of what we have to do is ask ourselves, why is this happening and what can we do to mitigate this in the future? I think there's no question in my mind that African Americans, we're seeing these trends in the data because for a couple of reasons. One, they're among the most exposed because if you look at individuals who are frontline workers, when we talk about essential workers or employees that are bagging your groceries, that are driving the bus or the train, or police officers, when we look at what we see is that African Americans are overrepresented among workers who are considered essential, and as a result, have greater exposure and risk associated with COVID 19. And on top of that, the second issue is the social and economic disadvantages that African American communities face in Georgia and in this country. And so we've got to look at the policies and the systems that create disadvantage, whether that's to education, healthcare, employment, housing. All of those things are critical for ensuring that people are healthy, well, and have all the opportunities that they need to keep their families safe and healthy.
Will public health policy have to be altered or adjusted to respond for future pandemics, especially involving the African American community?
Well, I don't think it, yes, it should in the future. We should adjust our approach and our policies in the future, but it's not too late to make adjustments now that can help to address the challenges that are being faced in the African American community. Certainly, some of the things that we've seen include, cash assistance to families, expanded unemployment benefits, and additionally, access to sick leave. But there's more that can be done. Expanded paid family leave. When we talk about nutrition, and I mentioned 34 million children access free and low cost meals. Many of those are African American children. But for all children, making those meals available even during this time through grab and go format. We also can and are seeing school systems that are using bus routes to deliver meals, but also running into a challenge where the necessary employees and volunteers are there shortages. So that's an area that we could look at as well. Some states and localities are requesting USDA, United States Department of Agriculture, waivers to expand their SNAP and WIC programs, which are programs that provide a social safety net around access to food. Some states have requested permission to use those benefits so that beneficiaries can use the benefits for online grocery delivery orders. Those are the kinds of changes that can make a difference. And one of the other things I'd say that I think is critically important, and this will help in the African American community, but it will have a broader reach than that, and we should be doing this. And that is that if grocery store and food supply chain workers are going to be considered essential employees, then we need to figure out how to protect and compensate those individuals. They should be getting hazard compensation. They should have access to health insurance. They should have access to personal protective equipment. And they should be given priority with access to testing. Certainly, disease mitigation efforts inside of workplaces is going to be important for these workers, but ensuring that they remain healthy. But these are the kinds of things that we need to be thinking about from a systems and policy standpoint. None of those things is going to just happen on its own. There has to be leadership. There have to be policies and support for those approaches and funding at the end of the day. These things can't be done in many instances unless there's adequate funding and support to do it from the federal, state, and local government.
And you have seen some grocery stores taking proactive measures to protect their employees, putting up plexiglass shields, limiting hours. That certainly was a response to keeping their employees safe and healthy. You've also seen some grocery store workers that were going out on strike because they were not getting hazard pay or they were not getting fairly compensated. I'm speaking with Rodney Lyn. He's the interim dean of the School of Public Health at Georgia State University. Dean Lyn, how would you rate the national food access supply chain during the pandemic?
Well, it's very strained at the moment, and you have mentioned some of the things that are being done. I've talked about grab and go meals that school districts are doing. Food banks are really strained and doing all that they can during this time, and there have been local, state, and federal efforts to enhance access to food. It doesn't mean that everyone has the access that they need. And so I think we need to continue to look at this issue. Today is a great day to make a donation to a food bank, as an example. We've seen more stories on the news about cars lining up around the block many times because they're trying to get food from the food bank. So, more work is needed there. The federal government can do more to provide resources to states and localities to support the population that is in need. I think that the need is just so underestimated when you consider what's happening in the economy, the number of individuals who have lost employment. The need is extraordinarily great. And so I think there's going to need to be continued focus and additional resources provided to states and localities so that they can provide the support that citizens need.
And then what about the president ordering meatpacking plants as essential workers?
Again, if we're going to designate individuals or certain sectors or types of food companies as essential, then we just need to ensure that the employees, the workers, have the protections that they need, compensated appropriately, and have access to testing, mitigation, all the things that will give them and their families a greater peace of mind about them having to go out every day into the world where this virus exists. So the president has a difficult job to do, but as they're designating certain types of food manufacturers as essential, we just need to make sure that those individuals have the protections and the compensation that they deserve.
And as I've mentioned, the public health policy, yes, you could certainly adjust that for the future. And you are suggesting you could do it right now in the present. Do you think there will
That's
be
right.
a new normal? And by new normal, I'm saying, do you think that grocery stores will keep up the plexiglass shields, mandate specific hours, have glove and mask situations where people that is this our new normal?
That's a great question. I think it's reasonable to say that the world is going to be changed after this, and there are going to be behaviors that we adapt that are different, and the ways that we construct the physical environment is likely to change as well. I read a great article about architecture and how this pandemic might affect architecture in the future. And it was, a far-reaching, broad article. One of the examples was that elevators, maybe they're going to be voice activated going forward. I mean, that's just one thing. But the things that you note around shields and protecting workers, I think we're likely to see some of that in some places. I think people wearing masks and gloves. I'm not sure that's going to be out of the norm in the future. And in some parts of Asia, that's normal already, has been for many years. So yes, I think we're going to see changes, even maybe in the way we greet one another. Will there be as much handshaking and hugging? That remains to be seen. But I think that we've taken some steps apart from one another physically. And I think we may take one step back toward each other, but I'm not sure that we'll go back to where we were, at least not in the immediate future.
And we've been speaking about local, state, and national issues. What are your thoughts on more of an international issue, the threat of food insecurity? And what I reference is cross border, as borders are closed or were closed during the pandemic. What about food insecurity and nations trying to protect their own resources?
Food insecurity has long been an international issue, challenge, one that countries across the world have united to try to address. I imagine now that challenge is even greater. One of the challenges, I think, is that countries are so focused on what's happening at home and the challenges posed by COVID 19 that it's not clear to me uh, how well our effort to provide aid in a collaborative manner is going forward. So, I'm not sure I have a great answer to this question. Been spending a lot of time looking at what's happening at home. We certainly need to look at what's happening abroad as well.
And then you're the co-principal investigator for the Prevention Research Center at Georgia State. What is that?
Yeah, so the Centers for Disease Control and Prevention funds schools of public health primarily to establish prevention research centers, which are research centers really focused on improving the health of communities in using existing evidence to develop interventions and to apply them in community settings with the goal of improving the health of the population. We also look to gather information about what's working and what's not so that we may translate or replicate what we're doing in Clarkston, Georgia, which is where we are working with immigrant and refugee community. What are we learning about interventions to improve health and well-being in Clarkston that may have utility, value, and application in other communities that are like Clarkston in other parts of the country? We're really delighted to have been selected to be a prevention research center. It's a very competitive program, and we're one of only two new centers that were funded in this round. So we are really excited about that, and we have a wonderful team of folks that are working closely with the residents and the leaders in Clarkston, Georgia, to really look at collectively what are the priorities that we might focus on. So we work with the community to hear what their experience is and what they believe priorities are, and we together come up with areas of focus and ultimately develop and implement programs and interventions that will address those priorities over time. So this is a 5-year grant, and we're not even 1 year in, so we're enjoying the work and have had to pivot some to really address the needs that have emerged as it relates to COVID-19 burdens that's placed on the community.
Rodney Lyn, Interim Dean of the School of Public Health and member of the Georgia State Preparedness Task Force. Thanks for joining me.
Thanks so much for having me.